around the point of rotation, there is going to be a little bit of redundancy here. That's very normal, and so you'll get like the most laxity is going to be like this portion of your flap basically. But again, you haven't even rotated this like 180, which is really nice. You have very little tension extending all the way out to the very distal tip of your flap. So I'd be pretty happy with that.
We'll start suturing distally, here. We can remove some of this tissue.
If you need to, I probably
like the skin?
Yeah, honestly, I don't know that you'll need to do that for this. Yeah, like the way it's lying down, I think once you oppose that, you won't really be that bothered by it.
When would we choose horizontal mattresses?
Horizontal mattresses I usually use for tissue that has very poor like suture holding power, because I think you kind of like are able to recruit if you like your fibers are oriented parallel to your incision. So I would say oftentimes if I'm like trying to get like muscle belly together or just like tissue that again doesn't have great suture holding strength, if the tissues are parallel and I'm like making a bite here and pulling, I'm just gonna get pull out. But if I do like a mattress, I'm basically like cinching my suture around and kind of like pulling it. The downside is you're sort of everting, but it does bring stuff together.
This is basically, we undermine, we get our soft tissue going once we get here and cruciate all the way down.
Yes, and then I think like another great thing to point out, like this is really strong tissue here, and then on this side, I would use like this layer.
Yeah, okay.
Yeah.
Cool.
And that's gonna be like your tension holding.
Awesome.
Cool, it looks good. A well-planned flap. We love to see it.